The report on the investigations on the Global Fund in Uganda, conducted by the Inspectorate of Government in August last year, showed that Uganda's grant performance was poor. The report cited missing managers and frontline staff, especially for the managers of the National Malaria and TB program for 3 years now. This, it said, undermined the response to the disease, thus poor outcome.
Several years we've been demanding, we've been pushing that at least there is increase in healthcare providers, and yet you are reading a report that is telling you that you are not absorbing the resources, and that there is money that you should be using to recruit healthcare providers.
By the time the audit was done, there were acting officers in those positions, and the recruitment process was on. As I speak now, officers have been recruited for those positions. We have a substantive program manager in the National Malaria Control Program. We have a substantive manager in the AIDS Control Program.
The report also cited lack of structures to support the implementation of the funded programs, such as the Focal Coordination Office and the Regional Performance Monitoring Teams.
And the report highlights the difference of $1.9 million between drugs received and drugs dispensed, meaning that somebody profited from that difference. So on this, actually, we are calling for a thorough investigation. Yes, the Office of the Inspector General of the Global Fund has done the investigation, but as Uganda, what are we doing?
The investigators also found unspent funds and supply chain weaknesses, as well as poor absorption of the funds. The audit report found that only 46% of the funds disbursed to the Ministry of Finance between January 2013 and June 2015 had been spent. This poor performance of the grant means that people who need access to services cannot get them, and also compromises Uganda's future access to Global Fund monies.
We also recommend that there should be performance-based financing. If Ministry of Health is not consuming what it is supposed to consume, we shouldn't give them what they are asking. You know, if they are asking for too much, then we shouldn't give them the money.
By the time the audit was done, we had another 2 quarters to utilize the money. As I speak now, more money has been utilized, and we are very sure that by the end of the grant, we shall have absorbed all the money.
The Global Fund has set a very minimal target of about $13 billion US. That is so low compared to the need. But this means that if the Global Fund only gets this money, then they will tighten the amount of money that goes to the countries, which will highly likely depend on the performance.
Civil society organizations now want the implementation of the Global Fund grants removed from the public sector. They are also asking that the country coordinating mechanism should work with the Ministry of Finance, Planning and Economic Development instead of the Ministry of Health, citing failure to manage Global Fund grants in Uganda. In 2006, government set up a commission of inquiry led by then Principal Judge James Ogola to investigate the misuse of $200 million. Irene Namialo, NTV.